So good morning, everyone, and thank you for joining us. My name is Jennifer Larson, and I am the training coordinator for the Office of Community Living. And we'll just go through a few quick housekeeping reminders. We are recording this session with the intent of posting the recording on our website. So please be cognizant of sharing any personal or protected health information, either verbally or in the chat. Our team is going to be managing questions in the chat panel. So please type those in as you have them. And we do have a couple of slides throughout the presentation where we'll stop and kind of catch up on those questions, and we can take verbal questions at that time. We will be posting a copy of today's slides along with several other materials on our website. I'll put that website into the chat. Those are not available for you yet, but they should be by the end of this week. Few other things. If you are listening by phone only and you're not in the video portion of the meeting, you can still participate by pressing *6 to mute and unmute your phone, or press *9 to raise and lower your hand to be added to the queue. And Zoom does provide closed captioning. So if you click on the live transcript or CC button at the bottom of your screen, you can either turn that on or off. And with that, I will turn it over to Mariah to start the presentation.
Right. Awesome. All right. So thank you guys all for joining us today. We are here for the TA call, the Supports Intensity Scale, or SIS assessment, and support level rule changes. That's going to be our primary focus. I will go over an agenda here in a moment. This is presented by the Care and Case Management System Improvement Unit. All right, so just a few quick introductions. My name is Mariah Colress-Ecker. I am the Assessment Quality Lead in the Office of Community Living. I kind of help with all things SIS and support level assessment needs, including working with SIS assessors across the state. With me here today, we have Lori Thompson, the Care and Case Management System Improvement Unit Supervisor. We also have Nadine Smith, the Entry Point and Case Management Program Assistant and SIS Contact Liaison. And we have Christy Blickman, the Person-Centered Budget Algorithm Coordinator. So that's kind of my team today. I will be doing a majority of the presenting, and they're kind of going to be helping in the background, answering questions in the chat and managing kind of the overall time frame of it. All right. So the purpose of today is to really go through and explain the recent SIS assessment and support level rule changes. We will discuss the CMA's role in each of those rule changes and provide guidance to the CMAs on implementing these new rules and processes. We will also discuss new and updated standardized forms that kind of go along with these rule changes. And then, of course, answer any questions that you have throughout, but of course at the end as well. All right, so today's agenda, we are going to briefly kind of discuss the recent stakeholder engagement. Obviously, this has been a big piece, but we'll touch on that, kind of some highlights. We will then go through the 4 main areas, the SIS rules that we updated, including distributing the assessment, providing an annual overview, and then the new risk factor transition process. That's going to be kind of a bulk of this presentation. We then will also introduce 2 other new processes, the SIS reassessment support level restoration process and the expedited support level review, or the ESLR process. All right, so to discuss the recent stakeholder engagement, the department convened a SIS and support level work group, stakeholder work group, and a SIS assessor community of practice back in June 2022, and we met through March 2023. As those various groups, as we met, we discussed and reviewed concerns surrounding the SIS and support level algorithm, and we worked together to develop tools and strategies to address the areas of concern that were kind of discussed and discovered. The collaborative work really resulted in the need to revise the SIS and support level rules, which is why we're here today. So we really began down this road revision path with the vision of creating processes that are more equitable, transparent, and person-centered. So that was really our focus and our driving force when we began all of this. And we believe that these updated rules kind of captured that. We feel that those who will be especially positively affected will be those members who maybe don't necessarily have family or advocates to speak on their behalf. We've really seen this time and time again, where those who maybe have a louder voice or stronger advocates in place can see the changes that they need. But this will help support all members, especially those maybe who don't necessarily have that in place. This will help members, families, and the providers who serve them. We also, just to briefly touch base on, we also heard from and worked with specific SOMB, so the Sex Offender Management Board, providers and advocates, which will come into play. That's really that piece around the risk factor transition or step down process, but they were pretty involved with that piece as well. All right, so kind of to dive on in to the rules, the SIS assessment and support level rule changes. At the beginning of each rule change that we'll be discussing today, I have quoted that specific part of the rule that we changed or updated so that you guys can really see it, the rule language, and have it at your disposal. We also have provided links so that you can go and read the full rule. So that will take you to the Colorado Department Program Rules and Regulations. This is I would suggest bookmarking that link. It's really good to have at the ready and be able to access those if needed. And then the links in kind of these sections, so the various sections throughout the presentation, will take you to those specific pieces of the rule. All right, so let's talk about the first major rule change. So we have distributing the SIS assessment and support level results. So all of these rules, the implementation date is going to be May 31st. So we expect that as of May 31st, you guys will implement these rules moving forward. So beginning at that time, we expect that the CMA will distribute a copy of the SIS assessment, or also known as the SIS Family Friendly Report. So this is found in SIS Online and will be distributed to the member, their guardian, or their legally authorized representative within 30 days of the SIS interview date. You can use you will use the cover letter PDF that we've created as a cover sheet to that SIS assessment or to the SIS Family Friendly Report when distributing it to the member or guardian. In this, and I'll show it to you guys next, there's a drop-down menu, and you will put the support level in there as well. So it's kind of a cover sheet. I'll show you guys and walk through it at that point, but you'll use that as a cover sheet to distributing the SIS assessment. And then, of course, you will document in a log note the date that the SIS assessment, Family Friendly Report, and cover letter were sent to the member or guardian. So brief log note, just mentioning that you distributed it and the date that it was sent. All right. So here is the Supports Intensity Scale Assessment Report cover letter. So it's a very simple, pretty basic cover letter. You will enter the member's name and the date that the SIS assessment took place on. Then you will add in the final support level result. This, in the final PDF, is a drop-down menu with the support level options, 1, 2, 3, 4, 5, 6, the 1 through 6, as well as the option to put pending county notification, which I'll speak to that in a little bit, in a few minutes. You will then also put the support level effective date, which is the date of the SIS assessment or the SIS reassessment. The case manager will also use that date for any PAR revisions that need to take place. So you can use that date as kind of the effective date. And then at the bottom, the case manager will put their name, phone number, and their email address, sending it from the case manager, and so that the family can contact you if they have any questions. Right. So let's discuss some potential barriers to sending out the SIS assessment results within 30 days. So maybe you have not yet received the county notification or the financial eligibility, or the county hasn't put the member HCBS waiver choice into the bridge or CCM system yet. So you're still kind of waiting on the county. We know that this takes some time and it can be quite delayed. So if that's the case, on that cover sheet, please put on the drop-down menu, please put pending county notification. So you'll still send out the SIS family-friendly report and cover letter within that 30-day time frame, but you will just have the drop-down menu option read pending county notification. Another potential barrier is if a member is 17 years old, they're transitioning from children's services into adult waiver services. We know that the SIS assessment can take place up to 6 months prior to somebody's 18th birthday. And then, of course, you're kind of waiting for that 5 or 6 months until they are in adult services to kind of get that official support level result. So we know about this potential, barrier. If that is the case, please still send the SIS family-friendly report with the cover letter, the cover sheet, and mark pending county notification, because you're still waiting for the county to put in the adult waiver into the system. So you're still pending county notification. The CMA, the SIS contact, can also run a manual calculation sheet for the support level in those cases. We ask that you make sure to tell the member and their family that this support level, if run through a manual calculation sheet, is kind of unofficial until the system runs the support level through the system, essentially, and that is the official support level. So we just want you guys to make note that it is the unofficial support level until that time. But you can still run the manual calculation sheet so that teams and families can begin looking for providers for the adult services and obviously begin that whole process. The third big potential barrier is that SIS Online and the Bridge or CCM, the new care and case management system, have not connected. So the two systems speak to each other, and that is how the support level shows up in the Bridge or CCM. So every once in a while, they just don't connect. There can be a few reasons for this, but we ask that the SIS assessor, the CMA SIS assessor, or the SIS contact log into SIS Online and check that all of the demographic information matches what's in the Bridge or CCM. It matches it exactly. So specifically the date of birth, the social security number, the Medicaid ID number if they have one at that point, and the full legal name. This piece can get tricky if people enter in a nickname, or if they have multiple spelling variations, or if they've changed their name but not legally and not kind of in what the Bridge or what the county would be using. So it needs to match that specifically for the two systems to talk. So have the SIS contact or SIS assessor log in, make sure that all of that information is accurate, double check. And then if that's the case, you can then email the HCPF SIS inbox for further assistance. And, we've put the email there. It is the kind of standard SIS email inbox that the SIS contacts use to communicate with us. So you guys can email that and get further assistance that way. All right. So we are at our first kind of pause for questions. I'd love to hear from anybody. Feel free to come off of mute, raise your hand. What questions do you guys have about this first piece, distributing the SIS assessment results to the member guardian within 30 days of the SIS assessment?
Mariah, I've been monitoring the chat and trying to
Awesome.
answer questions there, but one thing you might be able to speak to now, print function in SIS Online, so access for case managers to be able to, print out and distribute in whatever means the member is requesting, whether it's US postal mail, emailed as an attachment. If you can speak to that, I think folks would appreciate that.
Absolutely. Yes. Thank you. So yes, SIS Online, the folks who have access to SIS Online are current SIS assessors and the SIS contact at each CMA, whether they be a SIS assessor themselves or are just kind of the primary SIS contact. They have access to SIS Online. And once the SIS has been completed in SIS Online, they can generate the family-friendly report, usually download it into kind of that PDF version. And I know each CCB kind of has, CMA has a different process around that piece of it, but getting that into the member's record, into their file. And then, of course, please distribute it at the means by which the member requests. So if the guardian or member requests email, feel free to distribute it in an encrypted email that way, or snail mail, whatever works best for them, dropping it off in person. So whatever they prefer, but please use that method. I hope that answers your question. A copy of their SIS should also live in the member record as well. Heather.
Hi, Mariah.
Hi, Heather.
Just a quick question for you. If we send out that cover letter initially and we're indicating that we're waiting on county approval, or that we're sending the unofficial level that was calculated with the calc tool, when everything finally does sync, do we need to go send another letter with like the official, like, hey, it synced and here's what we have? Or is just that initial letter saying we're monitoring this with a log note when it finally syncs okay?
I would say the latter. So you can then notify the member via email or a phone call and log note that you did distribute the support level, it finally did populate. You got that information to the member, but that doesn't need an official cover letter at that point. You can just communicate the official support level to the member, their guardian, and log note that if it does come at a later date. Does that answer your question, Heather?
That does. Thank you.
Awesome. All right. I think I saw Hannah's hand next. Hi, Hannah.
Sorry, too many buttons.
Okay, yes.
I don't know if this is a little bit off topic maybe, but if I'm asked to provide the family-friendly report from someone outside Imagine, I can't pull it. Or if a contractor did it for Imagine, I can't pull it off SIS Online.
Okay. Yes, if that's the case, please contact the SIS inbox, or you can reach out to me directly, and we can kind of get that SIS under the Imagine's kind of umbrella, or whichever CMA's umbrella it is, so we can kind of transfer it to the correct CMA. So that is if you've had a member transfer from a different CMA to yours, or like you said, maybe a SIS contractor did it, they work for another CMA, or they work outside of CMAs kind of all together, and we can transfer it into under that umbrella. So then you would be able to see it. So please reach out if that is the case. There's also, SIS Online has kind of created an update where if it's a SIS contractor, if they contract with, maybe 3 CMAs on a regular basis, they can mark which CMA it needs to go under. So if they're contracting, so that's kind of a newer thing. So let me know if folks who you're contracting with need access to your specific CMA. I can easily update that in the system.
Perfect. Thank you.
Does that answer your question?
Yes, it does. Thanks, Mariah.
Awesome. Good. Yeah. All right. So the next piece that we have is that the CMA, the case manager, will provide an annual overview of the SIS assessment results during the service planning meeting. So during the initial or continued stay review person-centered service planning meeting, the case manager will provide a high-level overview of the SIS assessment. You can use of course, you will have the SIS assessment itself, so the SIS family-friendly report. And then you will also have the CMA overview guide for SIS and support level results. So this is a standardized form that we've created that I will show you on the next slide. But again, just a high-level overview. And then AAIDD, the authors of the SIS, have a website with lots of resources. One of those resources being the AAIDD Respondent Handbook. This is a great tool, and I highly recommend CMAs and case managers use this Respondent Handbook. It is linked on these slides, so you guys can have access to it in the future. Or you can, of course, just Google the AAIDD SIS-A Respondent Handbook. So a great resource, a great tool for CMs to use. It helps talk about how the team can kind of use the family-friendly report in discussion, in service planning and supports. So kind of going from there. We want this to be a very high-level overview. We're not asking for, to go into too much detail, but really focusing on various areas, which I'll discuss next. We want you guys to review for significant discrepancies and or major changes in the member's support needs. So not, one score here or there that may have increased over the years, but really significant or major changes. And then the team can kind of determine, the member and the IDT can determine if a SIS reassessment request is needed or a support level review request is needed, or of course, if everything is status quo and there are no changes, then we can keep that as well. All right, so here is the new standardized form. So it's the CMA review guide for the supports intensity scale assessment and support level results. So this will be on our website for you guys to have access to. And these are the areas that you guys need to review. So numbers 1 through 5, and it really kind of goes step by step. But we expect that the case manager will go over the exceptional medical and or behavioral support needs identified in section 1 of the SIS assessment. So the case manager reviews the section's justification notes written by the SIS assessor and verifies that supports are in place to meet those needs. You'll then talk about priority support needs identified in section 2 of the SIS assessment. So going over the various life domain sections, so the home living, the community living, employment sections, and focusing on the priority support needs areas identified and making sure that any, services are addressing those, in the person-centered support plan. Of course, tied with that, you'll also review the support level and how it relates to the member services, maybe the SPAL if they're on the SLS waiver, or the provider rates if they're on the DD waiver, and SLS as well for day program. You will also look in the system for any risk factor or override. So please be reviewing any support level reviews that are currently in place and risk factor overrides that are relevant. Reviewing these, making sure that everything is still aligning and that the members' needs are being met. And then number 5 is the services necessary to meet these priority areas. So of course, making sure that the areas of high need are being addressed through the services. So you'll really use 1 through 5 outlined in this document to help guide your conversation. Having this conversation on a regular routine basis will help ensure that the current support level is reflecting the member's current support needs and making sure that those two are aligned. And then if there have been significant change to the member's condition or circumstances, or the current support level does not reflect the needs, the team and the member can identify and determine if a SIS reassessment is needed or a support level review is needed, and then of course proceed with those steps. All right, so once you've had that overview at the initial or annual service planning meeting, the case manager will document that this overview was provided in the relevant service planning log note in the department prescribed system. So case managers should already be writing a log note that the service planning meeting took place and kind of what was discussed. So we just want that this discussion, this piece, kind of an summary of it, be put in that log note as well. So like I just said, include a summary of the overview in the service planning log note, and then of course next steps if there needs to be a SIS reassessment or a support level review request submitted. So this is an example of a log note. For you, I won't read through it now, but you guys can refer to it if needed, and just kind of what we would like to see in that log note. But again, it's going in the already present relevant service planning log note. So just add a few sentences about this overview summary discussion. In the future, the department, we're working for phase 2 of CCM system implementation. We're working on kind of a checkbox attestation. So something where the member and the case manager are signing, saying that this did take place, and kind of go from there. We don't know what this will look like yet, but we are working on developing that. For now, a log note will be sufficient. Any questions about reviewing the SIS with the member at the initial or annual service planning meeting? I think I see Linda's hand up. Linda? Do you have a question?
Sorry. Yes, sorry.
That's okay.
Had a little trouble with
No worries.
with getting my mute off. This I think it's great and something that we should have had instruction on and doing all along. But I hate to say this, but this is going to be a huge ask for us to get case managers trained on interpreting SIS and reviewing with individuals at every service plan meeting at this point in the game. We are really struggling to keep case managers on right now. And I don't have, maybe I shouldn't admit this, but I have no confidence that this is going to happen consistently at our agency. Typically what we do now is when individuals have questions about their support level, and many of us, I mean, even though we've done a ton of SIS reassessments, we still have a lot of them that haven't been done since 2008 or whenever it was that we initially did these. And so I attend special IDT meetings with the team to explain what the SIS is all about, because leaving the SIS to be interpreted by an individual who doesn't fully understand it just leads to more difficulty. And that's when we get people going through their original SIS assessment and rescoring and bringing it to their new assessment. They're scoring based on their interpretation of the question and not the actual interpretation of the item. I just have a real struggle with this.
Sure. I hear your concern. I think it is valid. I will say that in order for teams to be aware of, including the case manager, who's ultimately kind of the gatekeeper, for the funding and services, everybody does need to be on the same page about this. And that we really feel that in order to have kind of equitable, transparent conversations, that the SIS needs to be a part of that. It is a driving force in the support level and the funding that kind of goes along with that. And so it needs to be a transparent conversation. Now, I hear you on your concern around interpretation of questions, of the rating key. So we really ask that CMAs work with every CMA typically has a SIS assessor and or definitely should have a SIS contact. And so to work with them in order to kind of get an understanding of the SIS. I hear you, interpretation, it is a piece of it, but that's where the SIS assessor should come into play if they are granted a SIS reassessment. And most, they've been trained on how to navigate those conversations, even when somebody comes with a scored packet, which is already currently happening now.
Right. My challenge is between everything else that we are juggling to try to maintain case management and meet the needs of individuals, to now go back and train all case managers on the SIS assessment is a huge ask. We don't have time to do what we're doing now. I don't know where I'm going to squeeze in another training, and they will need to be trained on it, definitely. And to have these conversations at every service plan meeting, I'm really struggling right now. And I'm the only current fully trained SIS assessor at my agency. So it will all be on me.
I hear you. I'd be more than happy to work with individual CMAs and, I'd be more than happy to help support, and whether that be kind of talking through the SIS with a group from your CMA, I'd be happy to do that as well. Lori, do you have anything to add to this conversation?
Yeah, Linda, we certainly understand that and share your concern. And we tried to make the guide that we created along with stakeholders' input as simple and easy to follow, and the overview itself to be one that didn't require interpretation of the SIS assessment, that basically the guiding force is really that section 1A and 1B, if there are glaring extraordinary needs that are identified there. And then if there's anything within the section 2 that stands out as an exceptional need, that those are just highlighted, but not really interpreting the SIS itself or going through all of the sections in detail or anything like that. Just really a very high level overview to guide, the conversation about our services really meeting the needs, and is the support level adequate to meet the needs.
Okay.
But I think that I think we will add that to the community of practice agenda as well, to really kind of talk through this some more.
Yes.
So I'm wondering how this process is going to interface with the assessment process that happens through CCM. in the new world.
Lori?
Yeah, so for people with intellectual and developmental disabilities who are newly enrolling and do not otherwise have a support level, the SIS will need to be continued to be conducted, basically concurrent to the new Colorado single assessment when we roll that out. And as you know, that won't come until phase 2, because when we roll out the CCM system in phase 1, we are still using all the legacy, the 100.2 and all of the legacy documents and processes within the new CCM IT system. Then in phase 2, when we roll out the Colorado single assessment, that's the point at which, if there are new enrollees, they will have to have both assessments done. And we recognize that is going to be quite challenging for members and case managers in that duplication of efforts. But again, that's only for people who don't already have a support level assigned. And it's one of the reasons we are really pushing away from reassessments to the degree that we can do that, and opting for the support level review process as a more efficient way to meet the needs of folks that have a support level that doesn't adequately capture their needs, and to not burden members and SIS interviewers to have to do another SIS assessment unnecessarily. So those are some of the ways we're trying to reduce the burden to the degree that we can. Does that answer your question, Pat?
A little bit. I'm only now becoming familiar with that. You have the level of care, and then there's going to be a follow-up assessment that is going to help guide what services are needed. And it seems like that process is going to be a lot of what we would be doing if we're reviewing the sections of the SIS with the people at the time of the service plan.
Yes, you're right, Pat. And I think that with the guide sheet that we have, if in fact the CSA, the needs assessment, captures those same needs, all of that information is auto-populated in the new CCM system. That's the beauty of the Colorado single assessment and the person-centered support plan. All of that information is auto-populated and captured, so it will make this process much easier. And I think that guide sheet will still be able to help you highlight the areas of highest priority need.
Hey, Liz, do you have a question?
Yes, I know you guys have a lot on your plate, and I don't know if other CMAs would feel this would be helpful, but I'm wondering if it would be possible for the department to develop a separate, this is more of a technical process, and maybe a separate training on just how to review that at the service plan meeting. And the reason I'm asking that is because we have contracted SIS assessors. I was trained initially on SIS assessments years ago, but my understanding it may be outdated. Other agencies may have people on staff, so they'll may go further into detail when they're training and looking at things. And one of thing that would be helpful if we were consistent in the amount of information and the level that we all shared with individuals and families, because otherwise you get this thing of, well, you should be able to do this and this because my case manager over at, I heard that this case manager at CMA such and such was able to provide this detail. And so if we had something consistent that could be directed specifically to the case managers at that meeting might be helpful.
Sure, and I do feel that the new standardized form will hopefully help make that conversation a little bit more consistent across the board. but I hear what you're saying, and we can certainly take that back and see if we can pull something together prior, around this kind of implementation of it. All right, we still have a lot to go over, so I'm going to continue on, but please continue to ask questions in the chat, and you feel free to email me and Lori afterwards to further discuss things as well. All right, so some other rule changes that I'll briefly touch base on. We extended the complaint process time frame for members to file a complaint about the SIS assessment from 15 business days to 30 calendar days. Complaints can only be filed by the member or guardian. They may not be filed by providers. This is due to kind of that conflict of interest piece there. So complaints about how the SIS was conducted may be filed by the member, guardian, or their legally authorized representative within 30 days. Only members and guardian have a right to their SIS assessment results. So CMA should not distribute the family-friendly report or the SIS profile and scoring form to providers directly. If the member or the guardian choose to pass that information along to the providers, that's their prerogative, but it should not come from the CMA directly or the case manager directly. They can be privy to that conversation, obviously the support level, and the conversation at the service planning meeting, but they should not receive a copy of this assessment itself. That should only be distributed to the member or guardian. Another thing I wanted to quickly touch base on, complaints being filed within that kind of 30-day time frame. We put that time frame in place, but if members and their guardians have a complaint and are either struggling to get it within that time frame, we will still definitely receive it and take that concern seriously. We want to know if there are concerns regarding SIS assessors, so we will of course still accept it and take it very seriously, but that time frame is in place. The other kind of update was the algorithm table. So we better articulated the support level algorithm table that is in rule with specific thresholds, creating floors and ceilings for each support level. So this does not change the algorithm at all. It just more clearly articulates the thresholds that have always been present. All right, so next we're going to talk about the risk factor transition process. This is when a member had a risk factor in place, but no longer meets that specific stringent definition for the safety risk factors. So whether that be the extreme risk to self or the public safety risk, convicted or non-convicted, but their needs really continue to be substantially higher than those typical of their assigned algorithm support level. So maybe they have a lesser algorithm support level, but with the risk factor in place, it brought their support level much higher. Members were really experiencing an unnecessary cliff when those risk factors were no longer in place, potentially dropping back down to their lower algorithm support level and experiencing a cliff. This was affecting the member, the providers who serve them, right? So it was jarring to everybody involved. So we want to try to kind of avoid that. And, it was always an option, but now we have kind of articulated and written out steps to access the support level review request process for a right factor transition. Right, let me just make sure I mentioned everything I wanted to there. We hope that this will help from having folks have kind of repeated applying and removing risk factors. If they can have a really gradual step down transition to more independence. Again, avoiding that cliff or that sudden drop back to their support level where providers may potentially not be able to support them. All right. So we'll go over this in a little bit more detail. I'm going to kind of try to speed up because we have a lot more to get through, but I have posted the definitions in rule for the extreme safety risk to self, as well as the public safety risk convicted and the public safety risk not convicted. So these are directly from rule. A couple things I want to point out really quickly are that in order to meet that risk factor definition, the member needs to have line of sight supervision or a controlled environment when the line of sight supervision cannot be fully met, and associated rights modifications in place. So it's very stringent, 24/7 line of sight supervision in all environments, continuous on-site supervision of the participant during which support persons must be within hearing and visual distance of the participant. So, very stringent definition. So when a person no longer meets that, this is the process that the CM and the team can take. So if it is determined that a support level review request for a risk factor transition is needed, we want you to fill out the updated SLR request form. I will go over that here shortly, but in that request form, we need to have all of this information kind of outlined. So you'll kind of go over the detailed information from the person-centered support plan, describing the extensive supports needed and the rights modifications that are in place. The plan in the rights modification to restore the member's rights in a comprehensive and structured transitional manner, sometimes referred to as a fading plan or a rights restoration plan. So these are already in place in the rights modification. So we're just asking that you kind of outline and discuss this piece in the support level review request as well. Then, of course, the steps taken in the plan and any progress that has been made to date, the extensive supports and supervision levels that are needed to maintain the members and or community's safety. And if a rights modification includes a controlled environment, so for example, locked and secured setting, window or door alarms, delayed egress, video, audio monitoring, describe how these are being or have been reduced to a less restrictive methods or discontinued. So again, the fading plan, the fading away from these potentially intensive supports and supervision levels to lesser so in order to get the member back to higher level of independence. The support, and then also please discuss the support level that's necessary to meet the member's needs during this transition period. So it's a support level review request. So you, as the team, determine the support level that's needed in this step down or transition process. We've created the updated review, but we will update the desk guide and have that posted on our website as well, so that case managers can really use it as a step-by-step guide to completing the support level review request. So here's what it looks like. We made, fairly minor changes. So this is the form that you guys should have already been using. We added a additional risk factor transition checkbox here. So we had risk factors impacting the support level, check all that apply, but we also have now added the risk factor transition checkbox. So check that if this is a risk factor transition SLR request, as well as the associated risk factors that they are transitioning away from or stepping down from. So you can check this box, risk factor transition, as well as if they are transitioning away from the public safety risk non-convicted. This just allows the panel, kind of gives them a clear snapshot of why this request is being made. Also on this drop-down menu, we've added risk factor transition. So another kind of easy way for the case manager to be aware that this is, and let the panel know that this is a risk factor transition request, and that they should be kind of having that mindset in mind as they review it. Then we added step 6 here. And the case manager only needs to fill out step 6 if they are submitting the SLR request for a risk factor transition or step down. So only if it is for that reason do they need to answer these questions. So essentially what I just read through on the previous slide is the questions here that they will answer. So of course, describe the detail steps, the plan, the progress that they're made to date, the extensive support and supervision levels that are needed to maintain the members and our community safety, check boxes around the controlled environment, and the support level necessary to meet the members' needs during this transition period. So all the things that I just went over, but put into this document for the panel to review. The department will review the SLR request with a standard support level review process. I'm sorry, I kind of fumbled there. So the kind of the standard SLR process that is already in place, you will submit it through the CMA SIS contact. They will review it. They will submit it to the department just as any other SLR request, and the panel will review it in the same time period as maybe the standard SLR requests. So the rights modification transition plan and the support level review. So if they've been approved for an SLR using the step down method, this must be reviewed by the IDT every 6 months, and the CMA must document the outcome in the member's record log note. So kind of reviewing this as a team every 6 months. Rights modifications that are in place need to be reviewed every 6 months. So we tried to just line it up with that time frame, so that they should then also be reviewing the rights modification as well as the support level review and the support level that is in place. The log note should include a summary of the discussion, any action items, of course, and then the kind of summary of the overall plan until the next review. The case manager will also need to update the related rights modification section in the BUS or the rights modification section PDF for CCM. We'll talk more about this document as well. But since the rights modification section from the BUS will be migrated after CCM goes live, case managers will be able to utilize a fillable PDF form to provided by HCPA for any new rights modification or changes to existing rights modifications, and then upload that form to the CCM record. So it's the same questions taken from the BUS rights modification section, put into a PDF fillable form for kind of the interim process. We're currently developing, we're in the final stages of developing this form, and when it's ready, it will be uploaded to the Long-Term Services and Supports Case Management Tools website, as with all other SIS-related items. All right, so when a member's rights are restored fully prior to the end date of the SLR approval period, so the team has submitted an SLR request. It was approved for a year, but the team has decided to fully restore the rights of that member prior to that year end date. We ask that the CMA notify the department by emailing the SIS and support level inbox, just letting us know that the support level review is no longer needed. They are back to their algorithm support level. The department can then override the support level in the system. The department will notify the CMA of any final support level changes and the effective date. The CMA will then make any necessary person-centered support plan and PAR revisions resulting from the support level changes within 10 business days of the effective support level change. This rule has not changed. Whenever a support level changes and a revision is needed, it needs to be done within 10 business days of the support level change. So that has not changed. Just wanted to make sure that was clear. And then the CMA must also notify the member of any support level changes. So anytime a member's support level changes, it is the CMA's responsibility to notify the member of that support level change. So again, no change there, but definitely wanted to make note of it. All right, I know that was a lot. We still have more information to go through. Are there any glaring or big questions at this time about the risk factor transition process and support level review? Anybody want to come off mute and ask a question? You know, this process was always, you know, the support level review process was always available to folks in this kind of circumstance, but now we've just really outlined it as a more direct way so that people aren't caught off guard by that cliff. So hopefully they can think about these things preemptively and submit that support level change, you know, kind of prior or along with removing that risk factor.
Hey, Mariah, it's Christy. Kiana has a question in the chat regarding notification via the 803 of any support level changes. If you want to.
Christy, I was just typing in the response. Good. So thanks for bringing it up from the chat, because I think there is some convoluting of or conflating of complaints, you know, disputes and appeals when it relates to the SIS and support levels. And so I want to clarify that it is only, firstly, it's only members who can file a complaint, a dispute, or an appeal, because those members are the ones that are affected and have that right. Providers cannot submit a complaint, a dispute, or an appeal on a support level. Complaints are related to if a member does not like the way a SIS assessment was conducted, they don't feel like the right respondents were there, the right information was gathered, they can file a complaint for any of those reasons. And, you know, there's an attempt to rectify it at the most local level as possible. And then if that's not possible, then it comes to the department. And almost always in a complaint, the department seeks to find a different SIS interviewer to conduct a reassessment. In the case of if there is an issue with a support level not being adequate to meet a person's needs, that's the point at which the member would ask for help from the CMA to submit a support level review request, or if they want a reassessment because they don't think this has adequately captured their support needs. There are several reasons why a person could submit a request for a reassessment. An appeal, on the other hand, is that formal process that is only initiated in the event of a reduction, you know, discontinued, reducing, or changed services within the SLS waiver. So because the SLS waiver has, of course, the SPALs, the service plan authorization limits, which limit the amount of services a member could receive. So if their support level goes down as a result of a SIS assessment, or it would be a reassessment, that's the point at which the case manager must send an 803 notice to the member because their services are reduced as a result of a support level decrease. And then the member has the right to file an appeal. That same process is not available for members in the DD waiver because there is not a SPAL. And so it doesn't affect the member still gets 365 days of residential services. They still get the same number of units of day services. It's the provider who is affected in that their rate is reduced. So the appeal process is not available for members in the DD waiver as it relates to a support level change. So hopefully that clarifies. And Kiana says that it looks like it does clarify.
Awesome. Thank you, Lori. All right.
Sorry,
Any
I need
other
to, Betty's indicating that there is a SPAL in the DD waiver for supported employment and day habilitation. And the SPALs, there is no SPAL in the DD waiver. There is no, the SPAL, the service plan authorization limit, is only in the SLS waiver. The DD waiver, supported employment and day habilitation, there are unit limitations that are imposed. There's 7112 units available to all members in supported employment and 4,800 units available to all members, whether they're in the SLS or DD waiver, for day hab services and supports. And those are hard unit limitations having nothing to do with the support level. So just wanted to clarify that.
Thank you. All right, we have 15 minutes left about, so I'm gonna actually pass it over to Lori to kind of talk through some of the history in preparation for our next new process.
Okay, thank you, Mariah. I'll try to move through this really quickly. As many of you know, we have seen an uptick in the number of reassessments as opposed to initial assessments, and our ratio of reassessments is higher than the number of initials, mostly due to the fact that we've now been conducting the SIS assessment for 17 years, and the chances of SIS being outdated for people who had their SIS assessment many years ago are much greater now as time has elapsed. So, given that all of this time has elapsed between 2007 and now, we've certainly have evolved in terms of our training of the SIS, our community of practice. We have become more consistent in the way that the SIS is scored and interpreted. And we've had AAIDD come in and provide us with a lot of technical assistance. And to that end, we've also expected that there is written justification in Section 1A and 1B for extraordinary medical and behavioral support needs. And as that has occurred, with all of the increased training and clarification from AAIDD, SIS interviewers are becoming more consistent in interpreting the item intent and the rating key. And so what we have seen happen now is that there have been occasions where there's been a request for a SIS reassessment, a reassessment has been conducted, and the support level has gone down. And that, of course, is the opposite of what members are seeking when they ask for a reassessment. And so we need to mitigate that situation in the rare circumstances that it occurs. And so we've put in place a process whereby the department will restore the original support level when that occurs. So, and now I think Nadine is going to walk us through the next slide that talks a little bit more about that process and how we're going to do that.
Really quick before we get to Nadine, who will walk us through that, I'm going to just touch base on kind of SIS reassessment requests. So I'm going to fly through this slide, but of course, all of these are kind of case by case circumstances, situations. So if you need further guidance on this, feel free to reach out. So really quick, we ask that CMA should exercise restraint on submitting SIS reassessment requests and only submit them when significant changes that are anticipated to be like an ongoing need, kind of a longer term need, have occurred for members. So kind of applicable significant changes for SIS reassessments. There have been significant changes in the medical and behavioral support needs section for a member. A significant overall increase in support needs in various domains such as home living, community living, health and safety. Changes need to be stable and ongoing. So the team has already kind of been working through these changes and has identified the support that is needed. And new medical diagnoses or behavioral concern that affects other areas of support need or have far-reaching kind of effects across the member's life and overall support. So some not applicable significant changes for SIS reassessments would be maybe 1 or 2 scores increasing in the medical or behavioral sections. The support level may not increase with minor score changes in the medical and behavioral section, or a few scores increasing in a single domain, for example, home living. So the raw scores in the SIS are then converted to standard scores. And so 1 or 2 point difference in those life domains are not going to have an overall effect on the standard scores and therefore could not change the support level. A new medical diagnosis or behavioral need has been identified, but other medical or behavioral support needs have decreased or no longer exist, right? Over the years, maybe some other extensive, exceptional medical or behavioral needs have decreased or are just no longer kind of affect that member. And so therefore, the overall support level would decrease. Even though you have a new medical or behavioral item, other ones have gone down. It's gonna kind of be an overall score, obviously. And then a brand new support need identified, but the team is still identifying the support. So these what if scenarios, there's a new diagnosis and the team is still really working out what those supports look like. They don't know yet. They are kind of the what if scenarios. So what this might look like. So make sure that you kind of have concrete support identified. And then changes in the lifelong learning, employment, social and protection and advocacy domains may not affect the overall support level. So keeping those things in mind. All right, I'm going to pass it over to Nadine, who's going to talk about our new restoration process. And I apologize, we're going to try to fit these 2 pieces into the last 10 minutes.
I will try and go fast. Thanks, Mariah and Lori. So I will be going over the SIS reassessment support level restoration process. And just to add on to what Lori said, the department knows that when a member or guardian requests a reassessment, the intention is to get an increased support level. So if they have a decrease, we want to restore the support level to its previous, or to prevent, an adverse impact on the member. So if a support level results, if a reassessment results in a support level decrease, the department will restore the previous higher support level. CMAs will not communicate the decreased support level to the member. If anything, please just let them know that it's the same as the previous level. This means the member will not have a decrease in services or the provider rate reimbursement. So the SLS fall, SLS and DD waivers. The department is going to pull a data report at the end of each month for the previous month. The department will retroactively restore the previous support level to the date of the reassessment. So there's no gaps in service levels there. Just a reminder, if you are a SIS interviewer, please enter those assessments in as soon as possible. This will ensure that when we pull the reports, they're accurate. Decision letters will be sent to the CMA SIS contacts within 5 to 10 business days of the data report. CMA contacts, if you notice there isn't been a restored bridge override, please let the SIS inbox know within 60 days of the last SIS reassessment. And the department began this process on January 1st of 2023. So anything from January to April has already been restored. If you haven't received a letter yet, you'll get that by next week. I think, Mariah, we can move on to the next slide. This will be the letters that you receive. So just a general letter stating the member's name, the CCB. It'll state the date of the last SIS reassessment is the date we'll restore it from, and it will have an open end date. Please note if risk values are entered and the level does go up, please notify the SIS inbox so that override can be ended and the risk value support level will then be approved in bridge. Another note is please, CMAs, please send this letter to the individual or guardian, as we're not doing hard copies for these letters. I think that covers that piece. Any questions?
Any questions about the support level restoration process? Certainly feel free to reach out to us afterwards if you guys think of anything, okay? All right, next we're gonna jump into the expedited support level review, or the new ESLR process, and Christy's gonna be presenting this. You're on mute, Christy.
Sorry about that. Good morning, everybody. I'm going to try to fit this in the next 7 minutes. So I am presenting an overview today of the new expedited support level review process. I'm going to refer to this process as the ESLR process moving forward for the rest of the presentation. The department has been working with a small ad hoc SIS support level work group to identify and address concerns related to the SIS assessment, administration, and the support level algorithm. So I just want to provide a little bit of background information on the SIS assessment related to its evolution in Colorado. In 2015, AAIDD added 3 exceptional medical items to the SIS assessment, and those included allergies, hypertension, and diabetes. And then in 2017, the launch of the interchange system and the SIS Online to Bridge interface occurred. At that time, the department made a policy decision to roll up the exceptional medical support scores into one other category without changing that current algorithm. So between Human Services Research Institute, or HSRI, quantitative data analysis, and ongoing data reviews conducted by the department, which started for 2017, the year 2017, for approximately 2 to 3% of the members receiving a SIS assessment, it was determined that a support level increase may be warranted. So to quantify that, from 2017 through 2022, we have identified approximately 100 members that qualify for a support level increase through the ESLR process. Next slide, please. Okay. As a result, the department felt it was important to establish a new equitable and transparent process that is very similar to the existing support level review process, but instead of having the case management agencies request an SLR from the SLR panel, the department is actually owning the ESLR process and completing most of the work. So the department will contact CMAs directly if we identify a member who may be eligible to receive a support level increase. The decision to increase the support level will be made by the department based on a very specific standard calculation related to the SIS assessment scores around those exceptional medical support needs. And the department, when we reach out directly when a support level increase is approved, we will provide you with a notification to member letter or decision letter for the case manager to forward to the member and guardian if applicable. We have established monthly data report polls, and those will be reflective of the previous month's SIS assessments. So again, like Nadine said, it's really important that SIS assessors are timely with their SIS assessment entry practice. CMAs only have a couple responsibilities with this new process. So the bulk of the work is completed personally by me. So you can feel free to reach out to me directly if you have questions about your responsibilities or to the SIS inbox. However, I'm going to go over that with you briefly today. Essentially, when we send the electronic decision letter to the CMA for the case manager to forward to the member and guardian when applicable. You just have to forward it per their preference, their communication preference. So if they prefer a letter mailed to them or if they prefer email, we just want to make sure it gets to them in a timely fashion. The sooner the better. And then the CMA is just to complete their standard service authorization revision process. And then in the letter, you'll see effective dates, which are highlighted here. I think it's under the important case manager will use these dates and support level number for revision, and we have that called out here on the screen. Essentially, we have two batches or two types, two processes. We have the historical years for the ESLR process, and that's 2017, 2018, 2019, 2020, 2021, and 2022. We've already completed a couple years, but we're moving through those years. And so you're going to see some letters come through, but the effective date will actually be a future date, a month date. So for example, I plan on sending out a bunch of letters around July 1st. So you may get that right before July 1st, like the week before, but the effective date will be July 1st for those historical years. However, for the monthly ongoing process, we are going to pull that monthly report on the 25th of the following month, and the SIS assessment date will then be the effective date for the ESLR support level increase. So for example, if somebody has a SIS assessment today on the 17th of May, that report's going to be pulled for me on June 25th, and then I'm going to make the effective date for the support level increase the 17th of May. So they're not going to have a kind of wonky support level history where they go up and down for a short period of time. So you can go to the next slide now. Thank you. And then this is the letter. Some of you, I've seen some familiar names, have already received some of these letters, so it might look familiar to you. So essentially the letter is pretty straightforward, but we did include some background information. The most important information is at the top, the demographic information for the member, and then the support level information. So this is what their support level was, and this is what it's going to be, and then the effective date, and it's also open and dated. So I'm going to wrap up there. Does anybody have any questions? Because we are at time.
Any questions about anything that we discussed today? All right, I will go to the next slide. So we have a resources page. So feel free to, these are links. You can access the long-term services and support case management tools. This is all things, there's a section for all things SIS related. So SIS documents, respondent resources, links to AAIDD, SLR, and reassessment request forms. And then we will also post the recording and the slide deck from today's presentation there as well. We also have our memo coming out, our operational memo coming soon. So that will be posted, of course, on the department's memos series webpage. But also we're going to send it out on the OCL biweekly newsletter. There is a sign up link here if needed, if you guys want to sign up for that. We will also email the CMAs from the case management inbox email with the information and the slide deck and all of the associated standardized forms. And then we also we'll kind of run it through the Case Manager's Corner newsletter, which comes out at the end of each month, so that it will be in there as well. So we have the operational memo coming soon. If you guys have questions, there are two kind of options. So you can email the SIS support level inbox. That is kind of for any questions, the decreased SIS reassessment support levels, and form submission. And then we have the case management email inbox, and that is for support level review and SIS reassessment request questions or concerns. So definitely make sure to have those 2 emails in your inbox as well. All right, any last minute questions? Thank you all so much for being with us today. We really appreciate it. We appreciate your time. We know how busy everybody is. So thank you for spending this time with us. Reach out if you have any questions or concerns.